All right, welcome back everybody to the brain injury discussion. This is going to be a brief overview about stroke and of course it produces a brain injury and maybe what we can do to prevent it. So with that being said, this is very common, so maybe we should take a look into this. Again, just to be a brief overview, like always, sources will be in the description below, and we'd encourage you to like, subscribe, or maybe leave a comment. So what is a stroke? Well, it's the second leading cause of death worldwide. So it's a very serious issue. Um, in medical terms, it is called a cerebrovascular accident, which they will sometimes abbreviate that as a CVA or cerebrovascular accident. And when we break that word down, cerebro, which points to the brain as a whole, vascular, so we're talking about blood vessels that go to and from the brain. We're also talking about those deep blood vessels. And we're talking about accident, which is something that, points to there was something wrong. Now, as you can see in this graphic here, um, obviously this is a good example of what a stroke can be considered, but we see a lot of neurological damage with a stroke, and it comes from two different sources. Ischemia, which is what we see here. Obviously, this clot is halting the blood flow from this area or vice versa to the other areas of the brain. And so we could infer that the person here having the stroke would see damage in that area because just like a car engine, our brains need fuel. And that fuel comes in the form of oxygen, of nutrients, and everything. When that fuel is deprived, brain cells start to deteriorate and die. So we also see that hemorrhage can be part of a cerebrovascular accident, but that's not really necessarily just another thing. It doesn't have to be both, but we usually see it ischemia, but you can definitely have neurological damage via hemorrhage as well. So again, main point of this is that it is a cerebrovascular accident, and when you see that on paperwork like CVA, you can assume that, probably a stroke. A stroke is something that we call it. So, but with that being said, let's continue. So, what are the risk factors? Some of these risk factors will be quite familiar to us, like we've talked about with anoxia and other things. There's risk factors for every potential for brain injury, and what we try to do is we try to reduce those risk factors. But the risk factors here kind of overlap with heart attack, with heart problems, cardiac anoxia. You know, these tend to overlap, and there's a couple that stand out, but obviously, cardiovascular disease, when we're talking CVA, right, that pertains a lot to the heart and the blood vessels. So, cardiovascular disease is probably very prominent there. It also ties in with heart disease. Obesity, obviously, if you live a sedentary lifestyle, your heart's not used to pumping all that. Um, that is known as a risk factor. Hypertension or elevated blood pressure, high blood pressure, that's a risk factor, because when your blood pressure is high, your vessels are constricted, so they go from being big to very small. So that is blood pressure. High blood pressure is the constriction of that. So physical inactivity kind of ties with the rest of this, right? If you're physically inactive, you're more at risk to get hypertension, cardiovascular disease, and so on. Alcohol and tobacco use, obviously, those are unhealthy habits. I wouldn't encourage anybody to use those, but that's a risk factor that is noted with stroke and other things, right? That seems to be a recurring theme is alcohol and tobacco use is just generally a bad idea. Diabetes is another one, obviously. And then, of course, hyperlipidemia or some sort of cholesterol disorder. And, you want good cholesterol, but you don't want bad cholesterol. But that'll be a discussion for you and your primary care uh, provider or, whoever regulates that. A lot of this, it tends to overlap with other brain injuries, but it also overlaps with other medical conditions. So we see a lot of overlap there. A lot of these are very common. And so, what can we do to prevent a stroke or cerebrovascular accident? Um, First, and I'm pretty sure these are pretty common advices, right? Physical activity or exercise. I'm not saying you have to go run a marathon, but maybe walking is probably a good start. Or maybe if you already walk, maybe make it a little bit longer. We can reduce our alcohol and cut out the tobacco. I mean, that's pretty simple. That's something that, not only will be good for your body, but it'll be good for your wallet. So if you want to think about that, that's a good way to save money and to reduce your stroke risk. Monitor your blood pressure, maybe just check it out once a week. Make sure that it's a healthy level. You want it, last time I was reading it, you want it about 120 over 80. That's about ideal. Every now and then, maybe you take a cholesterol test. But the real thing is, it comes down to healthy habits. You want healthy habits, right? If you create those healthy habits and you diet appropriately, um, you really get good prevention. And that's the stuff that creates prevention. And that's we can see in this graphic here. I mean, might look like walking on water, but that little miracle of just remaining healthy kind of really reduces your risk for all these things, including stroke. And so I'd like you maybe just to consider like what are the implications of just being healthy? Um, a little bit of exercise, a little reducing the alcohol, cutting out tobacco, just check your blood pressure once in a while, check your cholesterol once in a while, and just try to create those healthy habits. That goes a long way in prevention, right? And so this brings me to another point of, obviously this is a medical emergency when you do notice that someone is having a stroke, but what should we look for? That is a very good question. And here is the acronym. It's BEFAST. So look for balance problems. Again, if they're having that sudden loss of balance, they're not, maybe they're holding onto the wall. That might be a sign there. Eyes, maybe they can't see, maybe their field of vision goes from fairly decent to, oh my God, they can't see now. That would indicate that there's something wrong. So a facial droop is a big one. If we take a regular smile here, okay, that looks normal. But a facial droop probably looks something more like that, where they can't get the other half of the face. So typically it'll affect one side of the body. And so it'll go from that to that. That's the best way I can describe it is just, ask them, hey, smile for me. And should be what's called symmetrical or even on both sides. If it's asymmetrical, that might be a problem. Symmetry in the arms. This is something I remember from the Navy Corpsman School. Hold out the arms evenly, right? And, have them close their eyes when they do it. Now, if it's uneven, right, then that might show that there's a neurological deficit that could point to a stroke. Speech difficulty. It's like, hey, can you talk to me? What's going on? If they're having trouble getting that speech out, that might be something else going on. And of course, time. So the amount of time for treatment is actually a small window for like different stroke treatments, like clot busters or stuff, something like that. The time window is very, very small, especially in comparison to other things. But you want to get them to medical attention as soon as possible. Call 911, say, hey, person is having what appears to be a stroke. If they're having balance issues, a loss of vision, a facial droop, asymmetry as far as like muscle movements and arms, speech difficulty, and of course, time is limited. So those are things to keep in mind, especially when, this can be a very life-threatening injury. So what does this lead me to conclude, right? I know this is going to be a fairly short presentation, but this leads me to think that healthy habits are just generally a good idea. But if you look at healthy habits as a good idea, maybe we should also look at them as prevention. Not just be healthy, but healthy to prevent these bad things from happening. Time. Time is very important. And while researching for this, I found out that yes, there are a lot of good treatments out there, but the problem is that sometimes time is sometimes the barrier. Time to get to the hospital, time to get to a neurosurgeon. time to get to a neurologist. That time is important. So the sooner you recognize a stroke, the better. So this ties in with um, timely recognition. So if we timely recognize it, that means that we're able to get them the help they need as fast as possible. We also remember this is the second most leading cause of death. Unfortunately, this is common, so it might be a good idea to remember BEFAST, or at least remember some of BEFAST. And obviously, some of the risk factors are indeed preventable. And I do say some people are at more risk than others just by the nature of genetics. But this is one of those where, you know, sometimes this could have been prevented. And I would rather someone go to the hospital when they're starting to have symptoms and be ruled out than someone having to live with the regret of having to see, well, maybe I started seeing the signs earlier. So again, remember to be fast, and I'll pull that up here again. Balance, eyes, face, arm, speech, and time. Especially the asymmetry and the facial droop. Those are very common. But let's time is always of the essence. So with that being said, that wraps it up there on my resources. I hope everyone has a wonderful day. And of course, remember to be fast, or at least be fast in recognizing a stroke. And with that being said, everyone take care of each other. Like, subscribe, comment. We'd love to hear it.